if you are a lady and you experience symptoms, these symptoms I'm going to list now. Number one, itching and burning sensation in your vulva and your vagina. Number two, swelling and redness of your vagina and your vulva as well. Number three, you notice a whitish discharge with cottage cheese attached to it that is consistent. Number four, you notice burning sensation while you are urinating. Number five, you notice bruises like a kind of scar or a little cut in your vagina and also in your vulva. And sometimes, that's number six, when you are having sexual intercourse with your partner, you experience some pains, you understand? Okay, it's likely you have vagina yeast infection. Yes, that is what you likely may have. Vaginal yeast infection is a fungal infection. It's not sexually transmitted, okay? There are some certain things that put one at risk of having this vaginal yeast infection. Normal, as a woman, we have a this yeast infection, this yeast called candida in our body at a balanced level, okay? So when you do some certain things, these things will trigger it to make this yeast to grow. It will grow above the level, the balanced level that it is, and as a result of that, you will begin to develop this yeast infection called candidiasis. Okay, so these are the risk factors, the things that can actually make you have a vaginal yeast infection. Number one is if you are a pregnancy actually predisposes one to this vaginal yeast infection. Number two, if you're diabetic and you're not managing diabetes well, you're not monitoring your blood sugar, you're not controlling it well, you can also develop vaginal yeast infection. Number three is when you abuse antibiotics. You know, our vagina has a normal bacterial flora that helps to keep that fungal yeast in a normal level, in a balanced level. Now, if you abuse antibiotics, it will destroy that bacteria that is helping to keep that yeast infection in fungal yeast in a normal level. It will not trigger it to overgrown. And when that fungal yeast overgrown, that is when you begin to have what we call vaginal yeast infection. Number four is when you are on birth control pills. Yes, you are at the risk of developing vaginal yeast infection. Number five is when your immune system is suppressed. Yes, if you have any health condition that suppresses your immune system, you are also at risk of developing vaginal yeast infection, okay? So, and other lifestyle that we indulge in can also make us, expose us to having vaginal yeast infection, which is if you douche, this thing they call douching, and you dipping your hand into your vagina or in the name of washing, you are predisposing yourself to vaginal yeast infection. Number six is when you use scented tampons and pads, you're also at risk of developing vaginal yeast infection. Number seven is when you use deodorant in your vagina, you're also at the risk of developing vaginal yeast infection. And number eight is when you sit in a bathing suite or in a bathtub for a long time, it can predispose you to having vaginal yeast infection. Also, when you did not change out of a sweaty or a wet cloth, okay, for a long time, it can also predispose you to having vaginal yeast infection. Yes, so what do you do when you notice these symptoms in you? You heard the symptoms I've listed, and in your mind, you know that yes, what you are experiencing right now is yeast infection. The next thing you have to go do, you go to the hospital. When you go to the hospital or you go to a lab, they will carry out a test called HVS for you, which is high vaginal swab for you. They will culture that discharge that is coming out from your private. And when they culture you, they will know the particular drug that they will place you on. Normal, it's antifungal medication they will be placing you on, but you have to do that so that they will know the particular one that yeast infection will be sensitive to. So guys, this is what I have for you today. Bye. Thanks for listening, and don't forget to follow for more health tips.